Hi, it's Paul Slackett's Good News Broadcast. I'm speaking to Dr. Cynthia Yoshida. Hi, Doctor. How are you?
Hi, Paul. It's nice to be here.
Nice to speak with you again. We've spoken previously quite a few times about IBS, right?
We have.
And, what is IBS?
IBS is irritable bowel syndrome.
Okay.
We've talked about a lot of different GI issues.
And the GI is?
Gastrointestinal, a lot of digestive health problems.
Right. Gastrointestinal. Why do they call it gastro? What's gastro mean?
Gastro is stomach.
Right.
So that's the first part of our GI tract is we swallow, and then the food goes into the stomach, and that's the gastro. And then the intestinal includes both the small intestine and the large intestine, which is our colon.
How does acid, I had a whole conversation with a good friend last night about acidity. She said that she was able to go to some doctor, and they were able to say to her, you have too much acid in your body. How would a doctor be able to do that? Is they give you a piece of litmus test, and and you put it in your mouth like a swab, and when it comes out, it's either red or blue?
No, we don't. Thankfully, we don't have to go that far. Most of us can know about the acid that we're producing based on the symptoms that people are having. So people can have a lot of heartburn symptoms. And, at this time of the year and the holidays, it's not uncommon for us to have more heartburn symptoms. But also, people can have that feeling like there's water or some warm fluid coming up into their chest. And sometimes even a great way to look to see if you have too much acid is if people are having acid reflux, they tend to lose the enamel on their teeth. So we tend to get more dental cavities and caries and things. So sometimes just by looking in somebody's mouth, you get a good idea about whether or not their acid production might be a little bit too high, or they just might need to have inhibition of their acid with medications to prevent heartburn symptoms or to prevent some of these other symptoms that they might be having.
Okay. Now, I have this probably untrue belief, but I sort of believe it, that if you have too much acid in your body, acid, just like in the battery or anywhere, it burns things. So acid, and if it's in your insides, in your stomach, in your esophagus, and inside your soul, then it's burning, flesh or whatever's in you. And that doesn't sound good to me. It sounds to me like that potentially can be the cause of some very significant illness that a human being can get.
Well, sure. Definitely that's true, that our body makes acid. And, acid is important. It's a good thing for us to have because it helps us to digest. The acid that's actually in the stomach helps us to start the digestion process and the breakdown process of the foods that we eat. Luckily, the gastric acid, or the stomach acid, is in a place that is really well protected. The lining of the stomach tends to be very, very tight and close together. There's a lining of mucus over the cells that actually protects it from the acid. But the rest of the body, the GI tract, actually can be harmed by that acid. Thankfully, most of the times, our body can neutralize that acid by producing bicarbonate. Remember, that's the alkaline form that will neutralize that acid. Once the acid gets into the small intestine, the duodenum, the body will put out some bicarbonate, which will help to neutralize the acid. But if the acid is increased, it can lead to a lot of digestive problems. It can definitely lead to ulcer disease. So you can have small intestinal duodenal ulcers, you can have stomach ulcers, and also it can lead to esophageal reflux, where the acid can come back up into the esophagus or the swallowing tube and can cause a lot of heartburn, and sometimes it causes a lot of ulcers in that area too.
Okay. Is it predominantly ulcers is the most concerning problem from things like this?
Absolutely it is. Ulcers and acid reflux.
Okay. How about heart disease?
Heart disease? No. Thankfully, acid doesn't really get out of the GI tract, thankfully, and so it will not lead to other problems outside of the digestive system.
Cancer?
Cancer very, very, very rarely. And that can happen in people who develop something called Barrett's esophagus after having reflux for many, many years, acid reflux. But only people who develop this Barrett's esophagus have the highest risk of developing esophageal cancer. But, in very rare cases.
Okay.
Most of us who have heartburn don't really have a significantly increased risk of developing cancer.
So people get this more. They usually the reason why somebody would get this, I guess, are there two reasons. One is what they ate, and two is that their body just that is what your body's is.
Well, part of it is that, but part of it in this time of the year too, it has a lot to do with stress and maybe not eating as well as we should, taking in things that are high in fat like chocolate and alcohol. Those things definitely increase our risk of developing things like heartburn and things like that. And this time of the year, it's also really common for people to suffer from other GI woes with the holidays. And in my clinical practice right now, most people are suffering from constipation as a result of the holidays. We tend to eat more food that's low in fiber. We're not drinking as much water, and we're not exercising as much, and that can make people constipated this time of year.
Okay, let's talk about remedies for these concerns. What are some?
Definitely, lifestyle changes are the first thing that we talk about. So during the holidays, moderation is key. Making sure that if you're going to eat these great holiday treats that we have, make sure that you're getting in enough good food along with that, especially fiber. Making sure that you get in enough fiber in the form of beans or peas or lentils, which are very great in our soups and stews that we have at this time of year. Making sure that we're drinking plenty of water as we're out in our holiday parties. If we happen to be drinking alcohol, it's a really good thing to have a glass of water in between because it will really help us to keep ourselves hydrated and prevent any constipation. And if those lifestyle changes don't work, then I usually recommend that my patients take an over-the-counter laxative, something like MiraLAX, which might be useful to them to help them to keep regular and so they can enjoy their holidays and not have to worry about any digestive woes.
And what would a MiraLAX do?
MiraLAX is really helpful because it is a gentle laxative that helps to keep people regular. It's in a powder form, but it's gritless and tasteless. So you mix it into any liquid, water, coffee, orange juice. Has no taste or no grit at all. And it helps our body to really gently bring the fluid into the GI tract and help to have a good bowel movement without the severe side effects like bloating or cramping or sudden urgency.
If you would just take baking soda, bicarbonate. My dad drank baking soda all the time. He'd have to get indigestion, and he would have that. Is that? But that I don't think helped with constipation or anything.
No, but from the other conversation that we had in talking about the heartburn, baking soda can work. But the problem is because it again is a base, and so it will neutralize that acid. The big problem with baking soda, though, is that it's sodium bicarbonate. So there's a lot of salt in baking soda. So people with high blood pressure, particularly, are going to really want to avoid that because you don't want to increase the salt load. So taking just regular over-the-counter antacids can have a lot less sodium in them, a lot less salt, and can be useful in improving heartburn. There's a number of other over-the-counter medications that can be useful there as well.
I use club soda also. How's that? That's sodium bicarbonate also?
It has the bicarbonate part in it, and so that's helpful. It has some salt in it, so you have to be careful about how much you're taking, but that'll work as well.
How about I put white creamed mint in the club soda? I seriously do that. I was some bartender said, "Well, try this. This is our household remedy for an upset stomach."
It does. It will help a little bit with the upset stomach. Know that if you take a little bit on drinking alcohol, and we tend to do more of that during this time of the year, it increases reflux events. So people tend to have more heartburn when they drink. So being careful about what you drink is important.
Isn't wine very acidy?
Wine can be acidic, and it can cause people to have more heartburn. Definitely, if we talk about the red wines or the darker liquors, they tend to have more GI side effects.
We should just have chocolate milk all this whole time.
That's what I drink. Chocolate milk and eggnog.
And you don't put any rum in the eggnog?
No, try not to.
There you go. All right, Cynthia, thank you very much, Doctor. And for sharing, you have a website here too, MiraLAX. We'll link over to that. It's always a pleasure to speak with you, as we have each year in a very timely time for concerns like this. So, last question. What's good news for you?
What's good news for me?
Yeah, what's good news?
Good news is keeping ourselves healthy and regular during the holidays, and really enjoying them with our family and friends.
Okay, that's beautiful. Thank you. Happy holidays to you and your family.
Thank you.
Bye-bye.